Have you ever stopped to think that your blood is actually trying to talk to you? Seriously. It's not just flowing around doing its job. It's sending out signals, really clear messages, especially when something's not right. So let's jump in and learn how to speak its language.
Yeah, think about it for a second. That sudden backache, that weird rash, we usually just brush that stuff off, right? Minor annoyances. But what if they're not random at all? What if they're actually clues? Little breadcrumbs your body's leaving for you. Together, we're going to decode some of these messages.
Okay, picture this. Someone's getting a blood transfusion, and bam, sudden sharp pain in their back. Their heart starts hammering in their chest, and they break out in itchy hives. These things are not a coincidence. They are the textbook flashing red light signs of a blood transfusion reaction. It just goes to show how critical it is to listen when your body screams at you.
All right, so let's start with our first big category of signals. This is all about what happens when your body is running low on something vital in your blood. We're talking about scarcity. And you'd be surprised. The biggest clues often show up right on your skin.
It's kind of amazing, isn't it? How a problem deep inside can broadcast itself on the outside. When you see stuff like purpura, those bigger purple splotches, or petechia, which are like tiny red or purple pinpricks, or even if you just find yourself bruising like a peach, that's a visual SOS. Your body is pointing to a very specific problem. You're short on platelets, those tiny little cells that are supposed to stop you from bleeding.
Now, the official medical name for this is thrombocytopenia, and if you break it down, it makes perfect sense. Thrombo relates to clotting, cyto means cell, and penia means a deficiency, so a deficiency of clotting cells. But here's the crucial part. Those little marks on the skin are the warning sign. If you ignore them, the risk of serious internal bleeding goes way, way up.
So, if your body is waving this huge, easy bleeding flag, the strategy has to be all about playing defense. This is where we get bleeding precautions, and it's just a common sense safety plan. Every step here is about prevention. An electric razor means fewer nicks than a blade. Avoiding aspirin is huge because it makes platelets even less effective. And of course, you want to avoid bumps, bruises, and extra needle sticks. It's all about reducing the risk of a bleed, big or small.
This whole idea of scarcity also shows up in anemia. But get this, not all anemias send the same signals, not even close. On one side, you have iron deficiency anemia, which gives you these kind of general clues, feeling wiped out, looking pale. But on the other hand, you have pernicious anemia, which has this wild, super specific sign, a beefy, red, and oddly smooth tongue. Two totally different issues, two completely unique signals.
So for that classic iron deficiency anemia, the strategy is usually pretty straightforward. You gotta get more iron. And hey, it's not just about eating a steak. As you can see, there are tons of great sources out there. Egg yolks, tofu, nuts, fish. They can all help your body rebuild what it's missing. But, and this is a huge but, for pernicious anemia, you can't just eat your way out of the problem. See, the issue isn't what you're eating, it's that your body can't absorb vitamin B12 properly. That's why the treatment, B12 replacement, isn't a short-term fix. The absolute key takeaway here is that it has to be lifelong.
Okay, so we've talked about what happens when you don't have enough of something. Now let's switch gears and talk about a totally different problem, malfunction. This is when your blood cells are there, but they're not working right, or sometimes you have way too many of them.
Let's start with polycythemia. This is the opposite of scarcity. It's a problem of excess. The body's just making way too many red blood cells. Think of your blood vessels like a highway. Now imagine a sudden, massive traffic jam, where the road is just clogged with cars. That's what's happening here. The blood gets too thick, and that can lead to some really serious problems down the road.
Now for a malfunction signal that is absolutely impossible to ignore, pain. And I'm not talking about a little ache here. We're talking about deep, intense, knock you off your feet pain that seems to come out of nowhere. This is the hallmark of a sickle cell crisis. And here's the reason for that awful pain. Normally, your red blood cells are nice and round, soft and flexible, so they can squeeze through tiny blood vessels. But in sickle cell anemia, they become hard, sticky, and shaped like a crescent or a sickle. These misshapen cells can't flow. They get stuck, creating a logjam that cuts off blood flow and oxygen to tissues. And that is what causes that excruciating pain. So, if the problem is a painful logjam, what's the number one most critical thing you can do to help? Hydration. The single most important intervention is to push IV fluids. Think of it like a clogged pipe.
You blast it with water to get things moving again. The fluids increase the blood volume and help push those sticky, stuck cells through the blockage, which brings relief and restores that vital blood flow.
Let's look at another malfunction, hemophilia. Here, the problem is with clotting. The blood just doesn't have what it needs to form a solid clot. And the most dangerous signal isn't a cut you can see. It's the bleeding you can't see. The classic sign is something called hemarthrosis, which is bleeding directly into a joint, like a knee or an elbow. It's incredibly painful and can cause permanent damage.
All right, now for what might be the most mind-bending blood disorder of them all, disseminated intravascular coagulation, or DIC. Just look at that definition. It's the ultimate contradiction. The body is literally bleeding and clotting at the same time. It's absolute chaos, a two-front war where the body's defense mechanisms are actually causing the damage. And this table just lays out that bizarre reality perfectly. On one side of the coin, you have all the signs of uncontrolled bleeding, petechia, blood where it shouldn't be, but at the exact same moment, on the other side, tiny clots are forming all over the body, causing catastrophic blockages like strokes, heart attacks, and DVTs. Two opposite problems happening at once. So with all these complicated signals and dangerous conditions, how do we keep people safe? That brings us to our final section, what I like to call the caregiver's code. These are the absolute must-know essentials for patient safety. First up is the challenge of neutropenia. To put it simply, this means the patient's immune system has been wiped out. The neutrophils, their frontline infection-fighting cells, are gone. They are completely defenseless. For them, a common cold isn't just a nuisance, it could be a life-threatening event. So the strategy is simple. You have to build a protective bubble around them. We call this reverse isolation, and every single rule you see here is designed to keep the outside world out. No fresh flowers, that's because they can carry fungus and bacteria. No raw veggies, same reason. It's all about creating a safe zone to give their immune system time to recover. Finally, let's talk about how blood can be a time capsule. This number, 3 to 4 months, why is it so important? Well, that's the average lifespan of a red blood cell. And there's a test called the hemoglobin A1C that can tell us how much sugar has stuck to those cells over their entire lifetime. That's why it's the gold standard for tracking long-term blood sugar. It gives you a 3-month average, not just a snapshot from one single moment. So, as we've seen, from our skin to our joints to our energy levels, our blood is always talking to us. It sends signals of scarcity, signals of malfunction, signals of imbalance. The only question left is, now that you know a little more of its language, which signal are you going to start listening to more closely?